Did you know it's National Chiropractic Health Month? Well, establishing a holistic approach to your physical aches and pains can mean long-term well-being. Joining us is Dr. Brantley Meier, chiropractor and founder of the Bridge Chiropractic. It's good to have you here.
Thank you for having me.
So, for someone who has been in 4 car accidents, I know what it's like to have aches and pains, neck pain, back pain. Want to kind of start off with just the importance behind chiropractic and it as a practice in general and what it aims to achieve.
Really the essence of chiropractic, we want to maximize the functioning of the body, right? Whether you're in a traumatic event like you've been in, or you're just sitting at a desk over and over again, we deal with a lot of stress, right? So what we want to do is we want to be able to handle that stress. We want to have the capacity or capability to handle that stress. So our job is to maximize the function of the body, optimize its ability to be able to handle that.
And you handle patients from infant stage all the way up to 100 years plus. So I want to talk a bit about pediatric chiropractics in just a minute, but when you're talking about, adults and as they get older, there's degradation of the bones and joints and tendons and all those things. So how important is it to maybe start thinking about incorporating chiropractics into your health regimen?
Well, we know that we're living longer, right? So with that, as you alluded to, things add up, right? That's really what it's about. Is it a lot of stress, a lot of inflammation, a lot of pain adds up over and over again. It changes the way we do things, which typically adds to that. So it's a compound effect. So honestly, the earlier you can start, the better off it is.
Well, yeah, because if you're experiencing an issue over here, you're compensating over here, and then it just is a domino effect of problems.
Right, it's one big chain. So sometimes where you're feeling the pain is not at all the issue. I had an injury or a patient that dealt with an injury in her shoulder, and it was because her foot pronated, and it basically went down knee, hip, dropped the thoracic spine into the shoulder, and so she ended up tearing a labrum because of the left foot.
Oh,
and so I see that all the time.
From the foot to up here.
Yeah, toes to head, everything connects.
They say the knee bone's connected to the leg bone is connected. I mean, it's
a good song.
It's a good song.
It's a good song.
Is that the first thing that they teach you in chiropractic?
It is. Honestly, we all have to stand up. We have to sing that song, and we're done.
And then you get your diploma, and then you open up.
It was a very easy first step.
Right. but it's actually a very complex science. Hence, the letters after your name as well.
Years and years. There's a lot to it, right?
Yeah.
But the body is a system, and if you understand the system, it does what it's told to do.
Are there any myths about chiropractics? Because when you talk about chiropractics, it's dealing with your bones, your bone structure. We know that has an effect on soft tissue and your organs. I mean, it envelops everything, as you've stated. So I'm just kind of curious if there's any myths about chiropractics that people think, having my neck cracked, or I'm a little worried.
I think a lot of people say a lot about a lot of stuff.
Right.
And so probably the neck crack is more so just like a fear, and that's understandable. I mean, getting somebody to your neck, but it's what I do all day, every day. So it's very easy for me. I wouldn't say there's necessarily any myths, overwhelming myths anymore, right?
Yeah.
Because maybe 10 years ago, 20 years ago, there's stuff, but I see a lot of medical doctors. I see a lot of nurses. I see a lot of people in the healthcare field that were uncertain of it and just didn't have experience. And I think really it just was from a lack of experience that made people wonder.
Yes.
And now that people have experienced it, they really understand what it's about. Obviously, we're not cracking any bones. We're releasing pressure, gaseous substances in the joints.
Well, they say, one of the myths that I grew up is that if you crack your knuckles, they're going to grow, this big. That's not necessarily true, right? Okay, well, that's good to know. Real quick, though, we alluded to the pediatric chiropractic. So you do assist babies in this field. And why would a baby need a chiropractic care?
The development of the spine is probably the most important aspect. The nervous system controls every single function of the whole body, right? So our job, the way we treat a child is exponentially different than the way we treat adults. But really what we're trying to do is we're trying to make sure that the spine develops like it's supposed to, so there's no interference with the nervous system. Nervous system can work at optimal capacity.
Okay, and I feel like we just scratched the surface in terms of pharmaceuticals, because the opioid crisis, of course, people taking a lot of painkillers to numb the pain, but they're not addressing the actual problem. We've run out of time, so I think, you know, unpacking more at a later time is certainly a necessity. I want to thank you so much, Dr. Meier, for joining us today.
Thank you for having me. I loved it.
Appreciate it. We're back after this.